The Senator from Washington.
Mr. President, I ask unanimous consent to speak as if in morning business.
Without objection.
Thank you, Mr. President. Mr. President, I want to start by addressing the news last night that Republican leaders have decided to try to make their awful Trump Care legislation even worse. Trump Care wasn't enough of a giveaway to insurance companies, didn't do enough harm to women and seniors and people with pre-existing conditions. So Republican leaders decided to double down in efforts to appeal to their extreme conservative base. They are now claiming that they can take away essential health benefits like maternity care, mental health care, and pre-existing conditions through the reconciliation process. But here are the facts. Republican leaders know, just as Democrats do, that measures to take away these critically important protections cannot survive the reconciliation process and could never get 60 votes in the Senate. They are simply trying to sell conservatives a bill of goods today in the rush to jam this through, but the more they scramble, the more harmful this bill gets for patients and families, and the worse it will be for any House Republican who will be held accountable for their vote. Now, as we all know, today marks the 7 years since the Affordable Care Act was signed into law. And while some here in Congress may view this as an ideal opportunity to ram through a reckless, harmful repeal of the law, I, for one, think about today a little differently. I remember 7 years ago standing with a young constituent of mine from Seattle, Marcy Owens, as we watched President Obama sign the Affordable Care Act into law. I'd met Marcy when she was about 11 years old, in the midst of some of the most heated moments of the health care reform debate. And to this day, I will never forget the stories she told me about her mom, who all of a sudden had become sick, was forced to miss work. Because of that, she lost her job and lost her health insurance. And ultimately, because she wasn't even able to see a doctor or get any care, she died as a result of her illness. And I took that story with me, along with countless other stories of families unable to access care, pay for medication, or see a doctor. And I used them as a motivation as my colleagues and I worked tirelessly to pass the Affordable Care Act. Just last month, I was proud to have Marcy, who's now 18, attend President Trump's joint address to Congress as my guest. Today, Marcy is still sharing her story, advocating for affordable health care as well as transgender rights. And she, along with millions of others across the country, is once again standing up, speaking out, and making it clear we cannot go backward. So, Mr. President, I come to the Senate floor to share some of the stories of families in my home state of Washington who are worried, they are afraid, and whose lives will be at risk if President Trump and Republicans take us down this dangerous path to repeal. People whose voices more than ever need to be heard. And I want to make it very clear why we are here and what's at stake. The House Republican Trump Care bill will have a profoundly negative impact on the lives and the well-being and the financial security of people across the country, people who are truly terrified about the uncertain path forward. Yet, Mr. President, for having such a profound impact, Republicans are seemingly doing everything they can to limit public discussion on Trump Care. This bill was rushed through 4 House committees without a single public hearing, no testimony, no expert view. House Republicans voted the bill out of 2 of these committees without a CBO score, without knowing how many people would be impacted. In the Senate, Mr. President, this week, every Senate Democrat on the Health, Education, Labor, and Pensions Committee called on the chairman to allow for a hearing to talk about this bill, and he refused. He ignored the request, and he held the hearing on other health policy instead. Mr. President, that the Health Committee has not been allowed to hold a single hearing to talk about and debate Trump Care is appalling and shameful. Not to be outdone, of course, the majority leader, instead of committing to give all senators time to review and evaluate the bill, has now said the bill will go straight to the floor for a vote as soon as next week, prompting even members of his own party to come out against this plan. In all, these efforts are unprecedented. They are wrong, and they speak volumes about the kind of bill they're trying to ram through. Because, Mr. President, we now know the facts of the bill. This bill will kick 24 million people off their coverage. It will cause premiums to skyrocket. Seniors will pay more for their care. It will put at risk those who are struggling with mental illness and substance abuse disorders, including opioid addiction. It would end Medicaid as we know it, and predictably, it attacks women's constitutionally protected health care and rights, defunding Planned Parenthood, and putting insurance companies back in charge of other critical parts of women's health care, including maternity care and cancer screenings and contraception. This bill undermines women's access to health care and women's ability to make their own health care decisions in virtually every way a piece of legislation could. So, Mr. President, I oppose this bill in the strongest terms, and I'm going to be doing everything I can to fight back against it, and I know Senate Democrats will as well. Families across the country are looking to us, and they have nowhere else to turn. Like many of my colleagues, I have constituents coming up to me constantly when I'm at home, asking me what's going to happen if this Trump Care becomes law. They are bravely sharing deeply personal stories about their health and their families and their fears, something they should not have to do, and they deserve to be heard. Erin Zerba from my home state of Washington deserves to be heard. She's been a teacher for 19 years and teaches in two rural school districts. But because of her part-time standing in both districts, she's ineligible for insurance. If it wasn't for Medicaid expansion under the Affordable Health Care Act, she would have no options. As Erin puts it, she is terrified to learn that Medicaid would be gutted under Trump Care. She has multiple disabilities, including autism and Ehlers-Danlos syndrome. She has repeated surgeries following a difficult pregnancy. The medication she has to take every day is so expensive. There's no generic form. She's one of millions of people. And Mr. President, I just have to say that we are going to fight back with every way we have, because the Trump Care bill that is being rushed through the House with giveaways being given to senators for their votes is not the way we take care of people in this country. Mr. President, I'm deeply worried about the process of this bill. I see the Democratic leader on the floor, and I know it's how important it is to speak, but I just want to say, as the ranking member on the Health Care Committee, it is appalling to me that we have had no hearings, no expert witnesses, no markup. We have not seen this bill, and it is being rushed through. It will impact every single American and deserves the time of day, not some created chaos, deadline, timeline that was created simply to pass a campaign promise and not to do the right thing for American people. Thank you, Mr. President. I yield the floor.